Welcome to my YouTube channel. Our today's topic for discussion is anti-epileptic drugs. In today's discussion, we will discuss prescription considerations, adverse effects, enzyme inducers, drug warnings, pregnancy consideration, drug classification. Consideration for prescribing: Category 1, Phenytoin, Carbamazepine, Phenobarbital, Primidone. This category must be prescribed by brand. Category 2, valproate and clonazepam, lamotrigine and oxcarbazepine, perampanel and topiramate, clobazam and zonisamide. In this category, clinical judgment if to prescribe by brand. Category 3, levetiracetam and lacosamide, gabapentin and tiagabine, Pregabalin and vigabatrin, brivaracetam and ethosuximide. In this category, not usually necessary to prescribe by brand. Adverse effects: S for suicidal thoughts and behaviors, L for liver toxicity, I for impaired bone health, M for minor blood dyscrasias, F for folate deficiency, A for acute psychotic reactions: vigabatrin, topiramate, tiagabine, T for teratogenicity, C for changes weight, A for antiepileptic drug hypersensitivity syndrome, T for thrombocytopenia. You can also remember adverse effects by work Slim Fat Cat. Enzyme inducers: anti-epileptic, carbamazepine, eslicarbazepine, oxcarbazepine, phenobarbital, phenytoin, primidone, topiramate more than 200 mg daily, perampanel more than 12 mg daily. Drug warnings: increased risk of suicidal thoughts and behaviors. Using Pregabalin, increased risk of congenital malformations in pregnancy. Use of Pregabalin and Gabapentin, risk of respiratory depression. Use of topiramate, risk of neurodevelopmental disabilities in children. Use of valproate, contraindicated in women and girls of childbearing potential unless conditions of pregnancy prevention program are met. Use of Phenytoin, risk of death and severe harm from injectable Phenytoin. Pregnancy considerations for anti-epileptic drugs: increased risk of teratogenicity with using anti-epileptic drugs in pregnancy. Risk is increased with use during the first trimester, and more so if 2 or more AEDs are taken. Safer drugs to use are lamotrigine and levetiracetam. Increased risk of congenital malformations if using carbamazepine, phenobarbital, phenytoin, and topiramate. Plasma concentrations: lamotrigine or phenytoin concentrations can be affected by physiological changes during pregnancy. Vitamin K value: routine injection of vitamin K can minimize the risk of neonatal hemorrhage. Folic acid 5 mg daily should be taken until the 12th week of pregnancy. Drug classifications: Pregabalin and Gabapentin. These are controlled drugs. Schedule 3, risk of abuse and dependence. Prescriptions are valid for 28 days. Maximum recommendation quantity is 30 days. Quantity should be in words and figures. Formulation to be stated on the prescription. Question for today's topic: medical history for question. Murted Ratol has joined the practice as a new patient and is booked in for a medication review with you. Upon reviewing his summary care record, you note that he is currently prescribed a medication generically which is recommended to be prescribed by brand. You ring his previous chemist to query what brand of this drug has been dispensed recently so that you can continue the same brand. So, which of the following is the least likely to be queried with the chemist? A. Carbamazepine, B. Phenytoin, C. Sodium valproate, D. Primidone, E. Phenobarbital. Comment down below with your answer.
Thanks for your time and support. Stay connected with me to learn more interesting pharmacological studies. Must ask any question or confusion in comment box. Let me know which medicine information you want next. Thank you.